Well, there are questions tonight about a controversial treatment for allergies.
Yes, it's called NAET, and some people swear by it, while others completely dismiss it. Here's CBS 2's Lisa Siegel.
Teresa Hamlin of Glendale is what you'd call a nature lover. Happily married.
Yeah?
And Baxter is her baby.
Brother, good girl.
She says it's a good life, but not always an easy one.
Waking up and I couldn't breathe. It was the scariest feeling.
See, Teresa suffered from allergies and asthma since she was little. Changes in weather, pollen, sugar, even dog dander. The list goes on and on.
None of the Western medicine was helping, and I would be put on some really heavy drug and taking my inhaler, sometimes probably too often.
Let's have your right arm up.
Then she heard of a natural treatment known as NAET. But this time, Teresa was not told to stay away from her allergens. She was told to hold them.
Still kind of fascinates me that it's non-invasive. You have all your clothes on.
Resist. Resist.
Here's how it works. Patients are tested for their sensitivities by holding diluted vials of common allergens. If the doctor spots weakness during any of the testing,
Instead of seeing it nice and strong, we'd see it go weak.
they're treated for that allergen. It all uses a combination of chiropractic and Chinese principles. That includes acupuncture, acupressure, and more. Teresa's doctor, Valerie Goodkin.
The very first thing we test are basic vitamins and minerals, and we use muscle testing or kinesiology.
The doctor says through the NAET technique, the body builds up defenses, and eventually those allergens that used to make patients sick no longer have that power.
Usually, an allergen will clear in one treatment.
Now, acupuncture is not uncommon when it comes to allergy work, but when it comes to this particular treatment, not everyone's sold. In fact, it's got its critics.
Dr. Kathy Green is an allergist and immunologist. She says more clinical research must be done, and patients with dangerous conditions,
Deep breath.
like asthma and allergies, need to be cautious.
It's important that they fully define their condition through blood, possibly skin testing, with a board-certified allergist and immunologist.
Dr. Goodkin actually agrees and recommends her patients always have medications on hand, just for safety.
There's a place for Western medicine. There's also a place for this treatment. I don't ever tell people to stop taking medications. But if people are finding that they're not needing them, I'm not going to tell them, well, keep taking something you don't need.
Resist.
As for Teresa, she is 100% a believer. She hasn't used her inhaler or asthma meds for months. And she says she no longer suffers from the allergies she used to. That includes this one.
Good girl.
And the great outdoors. In Glendale, Lisa Siegel, CBS 2 News.
Well, research is also being done to help children with autism.
Yeah, we have more information on cbsla.com.